Every year, doctors in the United States perform about 1 million stent procedures. Each one costs around $25,000, and the research, published in the world's most prestigious medical journals, shows that for most patients, they don't prevent heart attacks, they don't extend life, and in one remarkable clinical trial, a fake procedure performed with an empty catheter produced the exact same results. So, why? Are we still doing 1 million of them per year? When someone is diagnosed with significant arterial blockages, the instinct of both doctor and patient is to do something physical, something you can see and point to. A stent goes in, the artery opens up, the problem appears to be fixed, the logic feels airtight. Except the logic is wrong, and the evidence proving it wrong isn't new. It has been accumulating for decades. The problem, as Dr. Joel Kahn notes, is not that doctors don't care. It's that they are trained to use procedures, reimbursed for procedures, and not trained to prescribe broccoli. As Abraham Maslow once said, if the only tool you have is a hammer, you tend to see everything as a nail. At least 8 large randomized controlled trials have compared stents and angioplasties against medical therapy alone in patients with stable heart disease. In every single one of these trials, stents provided no benefit over medication alone in terms of preventing heart attacks or extending life. 8 trials, 0 benefit. Then came a trial that should have ended the debate entirely. It was called the ORBITA study, published in The Lancet. Researchers recruited patients who needed a stent and divided them into 2 groups. One group received the actual procedure, the other had the catheter inserted, moved around, and then removed without doing anything. A sham procedure performed under sedation, so patients couldn't tell the difference. The patients didn't know which group they were in. Their doctors didn't know. And the results, the reduction in chest pain, was identical in both groups. A $25,000 invasive procedure produced outcomes no better than a placebo. Bypasses are more complex. Dr. Kim Williams, former president of the American College of Cardiology, acknowledges that in genuine emergencies, bypass surgery can absolutely save lives, but for stable heart disease, only about 10% of bypass patients actually see their lifespan extended by a procedure costing $150,000. And because the underlying cause is never addressed, the arteries often reblock within years, and the patient is back where they started, minus $150,000. So here's the deeper question. Why don't blockages reliably cause heart attacks? For decades, cardiologists assumed the most blocked arteries were the most dangerous. Treat the blockage, prevent the attack. Simple, logical, wrong. Autopsies kept revealing something unexpected. The arteries that caused fatal heart attacks were often only 40 or 50% blocked, not 90%. Here's why. Arterial plaque comes in 2 types: hard, calcified plaque, relatively stable, and soft, non-calcified plaque, volatile, prone to rupture. When soft plaque ruptures suddenly, it triggers an immediate, life-threatening clot. And soft plaque lives in the moderately blocked arteries, exactly the ones cardiologists don't usually stent because they don't look critical. Stenting relieves pain, but it does not prevent heart attacks. The arteries that cause sudden cardiac events are often not the ones that look most blocked on a scan. And no stent can fix what it cannot see. Dr. Hans Diehl, a pioneer in lifestyle medicine, who developed the CHIP program, one of the first structured community programs for reversing cardiovascular disease, has been making this case for decades. The answer to heart disease is not found at the end of a catheter. It's found at the end of a fork. So, what actually works? Dr. Dean Ornish answered that question in 1990. His Lifestyle Heart Trial divided patients with serious arterial blockages into two groups. One group received conventional treatment. The other was put on a whole food, plant-based diet, combined with stress management, moderate exercise, and social support. After 1 year, the lifestyle group showed measurable regression of arterial plaque on imaging. After 5 years, their arteries were even less blocked. Blood flow to the heart improved by 300 to 400%. They were hospitalized half as often as the conventional treatment group. These results were published in The Lancet and the Journal of the American Medical Association, the two most prestigious medical journals in the world. The Ornish program is now reimbursed by Medicare and major insurance companies, the first lifestyle intervention ever to achieve this. And yet, as Dr. Khan points out, over a decade later, there are still very few programs around the country teaching these results. The medical curriculum hasn't caught up. The reimbursement system still favors procedures. Dr. Joel Fuhrman adds an important dimension: a high nutrient, plant-rich diet doesn't just slow the disease, it changes the biological environment in which the disease operates. When you remove the fuel, saturated fat, dietary cholesterol, excess sodium, and replace it with fiber, phytonutrients, and antioxidants, you change what's possible inside those arteries. Cholesterol levels drop 20 to 30% within weeks. Inflammation markers fall, soft plaque begins to stabilize and shrink. 1 million stent procedures per year, 200,000 second and third and fourth heart attacks per year in patients who already survived once and were never given the tools to prevent the next one. The math is brutal. The human cost is devastating. This isn't anti-medicine. Emergency cardiac care is extraordinary, and if you are having a heart attack, you want the best interventional cardiologist in the world in that room. But what you do in the weeks and years before that moment is where lifestyle has a power no surgical tool can match. The research is public. The tools are available. The doctors who know this, Ornish, Khan, Williams, Deal, Fuhrman, have been publishing it for decades. If this surprised you, share this video with someone who's been told they need a stent or has already had one. They deserve to know the full picture. Subscribe for more and tell me in the comments, did your doctor ever talk to you about diet as a treatment? The answers are always eye-opening.